is Dr. Siva Anoop Yella, consultant psychiatrist. Have you come across anyone who is constantly complaining of pain at different sites in the body and not getting relieved of any medications? And even after seeing multiple doctors, then it could be somatoform pain disorder. It is also known as somatic symptom disorder, which involves experiencing significant pain or other bodily symptoms that cannot be fully explained by a medical condition. The symptoms are real and distressing, but have no clear physical cause. The disorder often coexists with other conditions like anxiety, depression, or stress. So the diagnosis involves ruling out any other underlying medical conditions and considering the persistence and impact of the symptoms on the individual's life. Treatment typically involves a combination of medications as well as therapies like cognitive behavioral therapy and other approaches like relaxation techniques or mindfulness training. If at all you're suffering from this condition, then visit a psychiatrist as soon as possible and take treatment at the earliest. Thank you. Have you ever wondered how you are sleeping naturally? Some people can sleep within 5 minutes of getting onto the bed, whereas some have difficulty in falling asleep. There is one such hormone that is responsible for this, which is called melatonin. Melatonin is a hormone that regulates sleep-wake cycles. It is produced naturally by the pineal gland in the brain in response to darkness and helps signal to your body that it's time to sleep. Melatonin supplements are commonly used to treat sleep disorders or jet lag. In addition to its role in regulating sleep, melatonin also has antioxidant properties and may play a role in supporting the immune system. Research suggests that melatonin levels can be influenced by factors like age, light exposure, and certain medications. While melatonin supplements are generally considered safe for short-term use, it is important to keep in mind they should be given under medical guidance due to potential interactions. Exercising can also help you sleep naturally as it makes you tired and helps in reducing physical as well as mental stress. If at all you are facing with any sleep disturbances, consult a psychiatrist. Thank you. Are you aware that most of the medical illnesses also can lead to mental health issues like anxiety and depression? These medical illnesses could be hyperthyroidism, hypothyroidism, diabetes mellitus, hypertension, and even most of the cardiac problems also can lead to mental health issues. Even some cancerous conditions, long-term illnesses can also cause depression and anxiety. So if at all you are facing with any kind of such symptoms related to depression or anxiety following a medical illness or a long-term illness, then see a psychiatrist. Thank you.
Have you ever wondered about the keys to finding true happiness in life? Cultivate deep connections by spending quality time with loved ones and expressing gratitude for life's blessings. Find joy by pursuing your passions relentlessly, as they are the fuel for your soul. Practice mindfulness and meditation to quiet the mind and find peace within. Perform random acts of kindness and spread positivity to make the world a better place. Spread kindness wherever you go. It's the ultimate happiness booster. Explore the fascinating history of psychiatry, a field that has evolved over centuries. In ancient civilizations, mental disorders were often attributed to supernatural causes. The asylum movement in the 17th century led to the establishment of the first psychiatric hospitals. The 18th century saw the emergence of influential figures like Philippe Pinel and William Tuke, who advocated for humane treatments. The development of psychopharmacology in the 20th century revolutionized the treatment of mental illness. Today, psychiatry continues to evolve with advancements in neuroscience and holistic approaches to mental health.
Hello everyone, this is Dr. Siva Anoop Yella, consultant psychiatrist. Today, we celebrate World Autism Awareness Day, a day dedicated to raising awareness and understanding about autism spectrum disorder. Autism is not just a diagnosis, it's a unique way of experiencing the world. It's about embracing neurodiversity and recognizing the strengths and talents of individuals on this spectrum. As we come together to celebrate this day, let us reflect on the importance of acceptance, inclusion, and support for these individuals with autism. Let us pledge to create a world where they are valued, respected, and given equal opportunities to thrive. Autism awareness is not just about spreading knowledge, it's about fostering empathy and compassion. It's about seeing beyond the challenges and recognizing the limitless potential of every individual, regardless of their neurodevelopmental differences. On this World Autism Awareness Day, let us commit ourselves to build a more inclusive society, one that celebrates diversity in all its forms. Let us work towards creating a world where everyone, regardless of their abilities, can lead fulfilled and meaningful lives. Thank you. Together, let us continue to spread awareness, promote acceptance, and advocate for the rights of individuals with autism. Thank you.
On World Schizophrenia Day, let's shed light on the realities of living with this condition. Imagine a mind divided, where reality and illusion intertwine. The journey through schizophrenia is a maze of emotions and perceptions. Let's break the stigma and understand that those with schizophrenia are not alone. Compassion and awareness can be the pillars of support for those battling schizophrenia.
Have you ever wondered how your vote can shape the future of India? It's more impactful than you think. From local leaders to the Prime Minister, every vote counts. Make your voice heard in every local and national election. Don't underestimate the power of your single vote. It can make or break the path that the country takes for the next few years in India. When we all participate in the democratic process, we pave the way for a brighter and more inclusive India. But what happens when we don't vote? Our choices are left to others, and the nation may not reflect our true wishes.
This is Dr. Siva Anoop, consultant psychiatrist. Today we are going to discuss about somnambulism or sleepwalking. So what is this sleepwalking and why does this happen? So sleepwalking can happen in certain conditions like severe alcohol consumption or insomnia, and even severe mental illnesses like schizophrenia or bipolar disorder, and even severe depression. Severe anxiety can also be sometimes associated with somnambulism. And even certain brain conditions like brain tumors or any brain strokes could also be associated with sleepwalking. In this condition, the person might not be knowing that they are walking in their sleep. They might harm themselves. They might harm others also unknowingly. So we need to evaluate in detail about this condition, why is this happening, by doing certain investigations for the brain, and treatment should be started as early as possible due to the associated risks. So see a psychiatrist if at all you're facing with somnambulism. Thank you.
Hey, do you know the real deal about cigarettes and smoking? It's not just a cool thing to do, it's like playing with fire, but worse. Smoking doesn't just harm your lungs, it messes with your whole body, inside out. Imagine your body trying to survive a toxic tornado every time you light up. But hey, it's not all doom and gloom. There's a way out, a way to break free. Choosing to quit smoking isn't just about you, it's about taking control and living healthier.
Hello everyone, this is Dr. Siva Anoop Yella, consultant psychiatrist. Recently, we have seen in the news that people are behaving like zombies in a place called Sierra Leone in Africa. So why are they doing this? It's because of a synthetic drug called Kush. So this substance called Kush, it's a synthetic drug which is made of formaldehyde, fentanyl, tramadol, and also crushed human bones. So that is the reason people are actually digging up graves and trying to steal the human bones and crush them and make the synthetic drug. The withdrawal symptoms are making them do this. So what is the zombie drug? The zombie drug is called xylazine. It actually affects the whole body. It increases a lot of sedation. It causes the person to sleep for more than 20 hours continuously. It also leads to depression, severe anxiety, increased heart rate, lowering of blood pressure, and sudden deaths as well. Government of West Africa has declared a national emergency and Kush epidemic because of this reason. So people who are actually taking this drug need to be rehabilitated and treatment should be given for them.
Have you ever felt trapped by your own thoughts? Obsessive-compulsive disorder, OCD, can make everyday life a living nightmare. Do you spend hours arranging and rearranging things until they're just right? Imagine feeling the relentless need to check things over and over, like the door lock or the stove. The fear of germs, contamination, or harm can be overwhelming, leading to obsessive cleaning rituals. Constantly counting, tapping, or saying certain words silently to oneself can be exhausting and distressing. OCD can consume your thoughts and actions, but know that there's hope for recovery with the right support and treatment.
Hello everyone, this is Dr. Siva Anoop Yella, consultant psychiatrist. Have you come across anyone who is constantly complaining of pain at different sites in the body and not getting relieved of any medications? And even after seeing multiple doctors, then it could be somatoform pain disorder. It is also known as somatic symptom disorder, which involves experiencing significant pain or other bodily symptoms that cannot be fully explained by a medical condition. The symptoms are real and distressing, but have no clear physical cause. The disorder often coexists with other conditions like anxiety, depression, or stress. So the diagnosis involves ruling out any other underlying medical conditions and considering the persistence and impact of the symptoms on the individual's life. Treatment typically involves a combination of medications as well as therapies like cognitive behavioral therapy and other approaches like relaxation techniques or mindfulness training. If at all you are suffering from this condition, then visit a psychiatrist as soon as possible and take treatment at the earliest. Thank you.